Welcome to PT Chit Chat.
Welcome back, man. What's up, Nico?
What's going on, Payman? How you
Hey,
doing?
man. I love it. We're back at it. Episode 3, man. We've come a long way so far.
Heck yeah. Real quick, what does your shirt say right now?
Oh, I didn't want to spoil it right now, man. I was going to
wanted
save
see
this
it.
one.
No, that
Oh,
was
which
the
way
first
did we
thing I
go?
noticed. When you can't find me, it's because I'm doing notes. Oh, that's so good.
Physiotherapy in Canada in one sentence. Let's go.
Yes, always doing notes. I mean, pretty much everywhere we're all constantly doing notes.
Yeah, man.
Anyway, so feedback from the last episode.
Yeah, we got a question.
Yes. What was the question, Payman? I
The
forget.
question is the difference between physiotherapy, massage therapy, and chiropractor.
Oh,
Because you see, we find you find all three of them usually. In certain clinics, you usually see all three of them.
In Canada, in America, we don't. But that's
Oh, really?
that's
Oh, yeah.
really,
In Canada, yeah. In a clinics, you usually have
Yeah.
most of them working together. So,
But that's a really good question. So the biggest difference is the degree, first of all, right? Doctors of chiropractic is what chiropractors are. DPT, doctor of physical therapy, is what physical therapists are. And I believe massage therapists, I believe they have an associate's degree. So chiropractors and physical therapists, they go to school for 7 years. And I believe the massage therapist is only 2. So that's one difference. How else are they
from an
different?
education perspective, yeah.
How else are they different?
So if we talk about kind of their treatment approach, right? I think the biggest difference we're gonna look at is the treatment approach. Massage therapy focuses on mostly soft tissues, right? I believe,
Yeah.
mostly soft tissue work.
Muscles, knots in the muscles, things like
Knots and
that.
muscles, trigger points. There's different techniques like efforage and petrissage and all that good stuff that we learned in school.
Sure.
Kneading, etc. And then we got chiropractors who were mainly joint focused.
Okay.
I want to say, but also they're here in Canada. They also do ultrasound and laser treatments and different modalities. So
Yeah, there's definitely a big crossover.
and believe it or not, there's
between them.
chiropractors that actually are, I should say, believe it or not, there are chiropractors that are exercise focused as well, like
Yeah,
patient
that-
education, exercise.
There's a huge crossover. And physical therapists, of course, exercise based, right?
Well,
so I-
exercise and then also joints, mobs.
Yeah, so that's kind of
yeah.
what we're getting into next. So specifically the doctors of chiropractic and doctors of physical therapy, they coincide and they're super similar because, like you said, chiropractors are doing exercise, physical therapists do exercise, chiropractors do joint mobilizations and manipulations,
And we do that as well.
and we do that also. They do soft tissue and we do soft
And
tissue.
we do soft tissue. So there's a lot of crossover. But if you were to pick but we do have to talk about it. How do they differ? Well, chiropractors are joint focused, right?
So
Massage therapy is
most
soft
of
tissue
their
focused. And would you say we're maybe a little bit of both?
I
Or exercise? I'd probably say exercise.
we're
I'd go
exercise
with
we're exercise focused because typically the majority of a chiropractor's session will be on the joints, right? They'll be manipulating and just moving joints around. Majority of our treatments should be exercise based because we are exercise based providers.
Right. And
But
then
that doesn't mean but of course that means yes, we do a lot of soft tissue. I know you specifically, you said you do a lot of soft tissue.
Yeah.
I personally, I don't do a ton of soft tissue. I do some, but not a lot. And then physical therapists, we also do manipulations. We mess around with the joints. I do that.
You mess around with the joints.
Yeah, I do that
Because
probably
in
a little bit
Canada,
more than you
we
do.
already talked about some first one, right? We
Yeah,
can't do
you guys-
extremity manips, but we can certainly do other manips. But
Sure. Yeah. I definitely do that a lot. So how do you know who the right provider is for you?
I always kind of like it's always a tough question, right? People are like, oh, who should I see, right? Who should I see? And I like to think physiotherapists are pretty well educated in all fields, almost like a jack of all trades a little bit. With some people obviously liking certain techniques more. For example, I like doing soft tissue work, but does that mean I don't like doing joint mobs? No, I love doing joint mobs if it's needed. I also like prescribing exercise. It's really hard. That's a hard question. I'm not.
For me, I don't care where people go as long as they get better.
Oh, that's
Um,
nice. Yeah, yeah.
that and genuinely, back when I was in school, I had this mindset like, ooh, I don't like these chiropractors, like they're taking away our patients. But I come to realize there's a lot of great practitioners out there that are chiropractors, and they get people better. And just like there's bad chiropractors or there's bad physical therapists, and I wouldn't recommend somebody going to a certain person. So as long as they're a good provider and they get you better, I don't care which approach you take.
Yeah, I pretty much agree with that. I think I'm all for that. I still think like if you have a soft tissue based issue and you know, seeking a massage therapist may still be an optimal route just because that's like their specialty. But and if you have a joint problem, like for example, sometimes like people come to me and they have like let's say facet restrictions, right?
Mm-hmm. Mm-hmm.
Issues with the neck. As it happens to be facet.
Mm-hmm.
Um, my techniques are pretty good, but I know chiropractors spend a lot more time with joints.
Mm-hmm.
So naturally, I'm like, you know what? A chiropractor might be better suited to treat you, right?
Yeah.
Um,
And I've definitely talk to chiropractors. I have a lot of colleagues that are chiropractors, so I talk to them, and we discuss patient care and stuff, and what you would do in this situation. And honestly, a lot of their treatment and a lot of their mindset is very similar to physical therapy. Um, the main difference is we kind of focus more on the exercise part of it, and they focus more on the joint part
Now,
of
why
it.
do we focus on exercise part of it? You look at, all the studies out there. Exercise is pretty much it's in favor, right? We talked about the different levels of the studies,
Sure.
and exercise is basically at the top of the food chain, right? When it comes to that.
Yeah. And that's so kind of the reason the way I practice when I work in outpatient, I do manipulation, but I do it because I know it will momentarily give me an increase in range of motion, decrease pain. And with that, then I want to coincide it with exercise, because that exercise is what's going to keep it that position. The way I think is that a manipulation, it's going to help you only for a short time.
Like a short-term effect, right?
Yeah,
And that's
exactly.
like you said,
Short
that
term
sets you
effect.
up for that exercise. That sets you up to do the exercises to maintain or get a long-term effect, right?
Exactly. And
Yeah.
that's kind of how I practice.
Yeah, I pretty
Um,
much do the same. Well, not manip them first, but same idea.
right.
Same idea of soft tissues or joint mobs to get them exercising.
Right. Because once they get that optimal range of motion or full range of motion or decreased pain, then, we can push them into the exercises, and that way you'll stick. That way it'll stay that way. That way you won't need to come to me for the rest of your life.
Dude,
'Cause
that's
I
what
don't
I
want
tell
that.
people. Clients come to me, right? And they go, "How long do you expect to see me?" And I go, "I want to see you this many times. You may get better before then. You may get better later than that, right? But my
Hmm.
ultimate goal is to never see you again."
Yeah, and I tell patients that all the time, like, I like you, it was fun, but like, don't come back.
Yeah,
Like, stay healthy, stay well, keep
that's
up
the
with this.
goal. And is there is
Yeah.
there is there like a room for maintenance? Sure. Sometimes I'm like, you know what? I do this. I go, 2 weeks you're good by yourself, right? Okay, let's try 3 weeks, let's try 4 weeks,
Right.
and then let's try monthly, and then after a couple months, one, and like, okay, you're out, you're good. They're like, but man, what if it comes back? I'm like, trust me, man, just stick to it. It won't come back. You'll be all
Stick
right.
to it. Yeah, stick to it. It won't come back. You'll be good. But if for some reason it does, like, you know
Yeah,
where to find
I'm
me.
I'm still here, right?
Yeah.
I mean, unless we
Yeah.
move, right? Unless we move.
We're not completely getting rid of our patients, guys. We're
No,
not
no, no. That's not
throwing
the
them out.
goal. I know. I always emphasize that. I'm like, no, I'm still here for you. Like, if you want to keep coming, and that makes if that gives you, mentally, like, it reassures you that you're good, like, fine, man. Come once a week or once every 2 weeks, and we'll go through it. But ultimately, we want to get them better, and
Get them better as
I think we're
quickly as
good at doing
possible.
that with
Yeah.
physiotherapy or physical therapy.
So
Um,
that was a really good question.
that's a
You
tough
know,
one, eh?
yeah,
That's a
that was
hard
a
one
good
to
question.
answer.
I know,
Um,
because they do overlap. A lot of them just overlaps, and we do a lot of the
And
same
I, I
stuff.
I can see how the public wouldn't know which one to pick if we have a difficult time answering the question, right? So,
Yeah, go with
but
somebody you like. Go with somebody that
go with
will
someone
get you
yeah,
better.
exactly. Someone you like, you're comfortable talking to about your problems and your concerns, and someone that listens and is willing to address those issues, right?
Hmm.
So topic of the day, what do you got for the guys today?
So a couple of students reached out to us,
Hashtag
and
Reddit. No, I'm kidding. It did though. Yeah, some Reddit kids.
and they wanted to know kind of how to get to PT school, what PT school is like, what clinicals are like. And so I guess we can spend this conversation talking about that.
Yeah, I'm good with it. Maybe we can throw in a few stories here and there, right?
Yeah, a few stories to
Make it a
hopefully
little
make
bit
it
fun.
as interesting for you
Not as
guys.
dry. So,
So getting into PT school in the States, different schools require different things. We personally, I had to volunteer at a PT clinic, multiple PT clinics. The more diverse you are, the better. I probably did more than like 500 hours of volunteering. So I did that. I also showed that I was diverse, and so I did a bunch of hours researching. So I worked for one of my psychology professors and did some research with him.
okay,
Yeah,
nice.
yeah. Also joined clubs. Played a big role in the clubs.
Okay, I want to cut you there for 2 seconds.
Okay.
I love these stories because I heard them all the time when I was trying to get into PT school, right? People
Yeah.
do all these things just to get
Yeah.
into
Do
PT.
all these
I just
things.
want to
Right.
ask you one question. I'm not busting your bubbles or
Okay.
whatever, bursting your bubbles
Go
on
ahead.
podcast.
Go
Did you
ahead.
do this to get into PT school or were you genuinely passionate on doing it? And be honest in your answer.
The clubs, genuinely passionate about it.
Okay.
Genuinely passionate about it. The research, definitely did that just to get some
Okay.
hours, because I know you you need hours. Grad schools are looking for people that are well-rounded, or at least that's what I've heard. So that's what I did. So research, wasn't very passionate about it,
But you
but
still learn stuff, right? You
yeah,
still
I
learn
definitely
stuff.
learned stuff.
Yeah.
We actually like researched. It was like a drinking research, so it was actually pretty fun. So we paid people to drink.
Oh, that's nice.
Yeah. And then the volunteering hours, that's what, like the shadowing of physical therapists and stuff, that's what got me to figure out, oh yeah, this is definitely something I want to do. This is something that's interesting. So I shadowed in different settings with different people. And the one way to do that is just go to a clinic and ask them like, hey, are you guys accepting students to just shadow you? And most of the time, physical therapists love to teach, so we love having students.
Yeah. Okay. So that was like your kind of journey to get into
Yeah.
now did you apply to Duval right away or did you
Yeah.
also apply
So
to other schools or
so I applied to a couple other schools. I didn't take the GRE, which is like a grad test. So I don't know why I didn't take it, to be honest with you, but I didn't. And so I graduated from University of Buffalo, but I couldn't apply there because you had to graduate through their exercise science program. And I graduated through biomedical science with a minor in pharmacology and toxicology. So I was not qualified for that program. So I had to apply elsewhere. And so I just kind of found Uville, and I sent them my stuff, my hours. My GPA was, I don't know, like a 3.7. And just with those hours and everything, and then they took me in.
okay, yeah. So I also volunteered in a physiotherapy clinic in
How many
Canada.
hours would you say?
It was 6 months, man. Every day you do the math. I don't know what the
That's
math is.
okay.
I don't know
Okay.
what the math. Maybe like one day short, but
Okay. Yeah, that's a lot of hours.
I mainly did that to kind of figure out what I wanted to do.
Mm-hmm.
I would actually encourage everyone to do that because even then I would say the volunteer hours that I did do not correlate to what we do as a physiotherapist or physical
Right.
therapist.
Right.
I don't think it's a one-to-one accurate representation of the work field. You don't see everything that you have to
Right.
do because you're just a shadow, right? But so yeah, I did that. Um did I like it or love it at first? I'm not really convinced that I was like into it,
Mm-hmm.
but I liked the outcomes some of the patients were getting, how like they were getting better.
That was a fun part for me too.
Like
That's what
I
got
kind
me.
of enjoyed that. And I also kind of like the problem solving aspect of it. We'll kind of
Mm-hmm.
touch base more on that. I think that to me, that's the most fun, like problem solving and then finding the solution to their
Mm-hmm.
problem. And then they come in next day and like, whoa, like I'm going off tangent, but like I had a guy come in the other day, physician says elbow pain, wrist pain, carpal tunnel, right? and I was assessing the neck, and we did some neck stuff, and he goes,
Mm-hmm.
I just want to ask you a question. Like, am I supposed to feel better all of a sudden from it? And I'm like, well, I didn't want to mention it, but yes.
Yeah, from just strictly from the neck stuff.
Just from the next,
Because
but
of
anyways,
course, because centrally you go centrally.
yeah, just going off tangent, but yeah, no. So I did 6 months of volunteering. Um, I didn't do any research, but my program was very heavy in stem cell and like neurosciences, and so I did obviously the 4 years university, like just like
Mm-hmm.
you had to do. I took a lot of functional neuroanatomy, brain stuff. Um, I took neurosciences, cardiopulmonary. Like I took all that, and
Right.
um, I know those are not requirements per se, because most of the requirements are like your chemistry, right? Chem 1 and 2
Yeah.
with lab. I want to say physics, some
Physics, organic
sociology.
chemistry,
I don't know.
bio.
Organic chem wasn't a requirement, I don't
Oh,
think.
really?
No, because I didn't have it, and I got it.
Biochem.
If that was, thank you, Dual. And I'm kidding.
I don't know. There's definitely. Oh, that's wherever you're applying. Make sure you look at the school's requirements and
Yeah, it's all
see
different.
what they want. Yeah, every school is different. So make sure
Um,
you do that.
but no, I took a lot of those courses, and I honestly I encourage anyone who's applying to PT school to kind of take some neuro course, some cardiopulmonary course in university if you can, because that's ultimately going to help you throughout school.
But it's not necessary because I
It's
didn't
not
take
necessary.
any of those.
Okay,
I didn't
yeah.
take any of those.
Well,
Not necessary.
we're not all a genius, but
I'm not a genius.
so I did that, and then well, you already know from the first podcast.
Yeah. Okay.
We're not going to talk about my failures. We're going to talk about my successes. Okay.
Hey, failures is important because if you're not failing, that means you're not pushing
Hey,
yourself.
listen, man, it was hard. If anyone that has done the Canadian exam will know that the multi-mini interview test where you walk into a bunch of doors and you answer your questions in 2 minutes, and you got the examiners looking at you all, like, what are you talking about? It gets a little bit intense from time to time.
Right.
But
Okay, so that's getting into PT school. Now, how is school like? So 3 years, including summers, so that's 9 semesters.
yeah, it was a 4-year condensed
work.
program, wasn't it? It was a condensed 4-year program, right?
Was it?
Or condensed? Yeah, we had to do
don't know.
summers. I think so.
Yeah,
I think.
I mean, I don't know, but all I know is it was 9 semesters total.
Which is a lot.
So kind of describe your experience with school.
Like academically or socially? Because socially it was fun.
Everything. I mean, everything. How was school for you?
So, okay. First day, right? We're all like, man, we were talking about this a little bit earlier, but I call it the round table. But those circular tables you sit on in orientation, do you remember?
Sure. Yeah. I remember sitting on a round table.
Yeah. So the right away off the memory, I can remember I was sitting with Adeline on the table, Jennifer August. I think Julian was there, maybe Caleb. And out of everyone, Caleb was the most stressed, right?
Caleb was the most stressed.
He was the most stressed, man. He was all in like I think he didn't have a suit on, but he was in a dress shirt, and I'm in my sweater. I probably still have it. But I know, face roll. And they were asking us, well, why do you guys want to do PT, right?
Right.
And then everybody's giving these wonderful answers of my grandmother had this condition, it inspired me to do this, and so on and so forth, right? I call some of them are genuine, some of them are kind of brushed up to make themselves look good.
Okay.
But Caleb goes, he's in quiet, he turns to the table and he goes, man, doesn't anybody care about how much we make or something like that? I'm like, dude, I love this guy. I was like, you know what? He's right. He's right, because ultimately, if you can't feed yourself, you can't help others. So
yeah.
But anyways, that right away was a great start for me. I was like, this is going to be a good year. School wise, academically, first year wasn't too challenging. I didn't think it was pretty basic physiology. It wasn't too hard. I thought initially I wasn't as social, so I was kind of sitting at the back and doing my own thing. I was also commuting back and forth home
from
on the weekends. I was living on campus, but I would go home every weekend.
Okay.
I should have probably stayed more, but obviously the second year I stayed more. I think not a second year, but the first year fall I stayed more. And I started to start forming connections with people. And I think ultimately that's what made it fun for me. But
That's
overall,
good.
school was all right. Like academically speaking, like I'm one of those people. Like I'm pretty good at studying. Like I have a good
I am
method.
so jealous of you, man. I remember I'd be there studying in the library, and you come in, you just stroll in, and be like, "What you doing, Nico?" I'm like, "Oh, I'm studying." And then you'd be like, "Oh, that stuff is easy." And then
But
I'm like,
listen,
"What
man.
do you
Listen,
mean?"
but let's
You
just.
because you have a really good memory.
I have
That's
and I have a method. I have a systematic method. Like
okay.
I have it. Like okay. So first of all, quizzes, 160 slides, cake, right? That's no big deal because you go through the slides, and I like teaching people. So I literally walk around and talk to myself. That's how I learn. Like I I just like explain it to myself. So I'll look at a slide, I explain it to myself. That's how I do
Right,
it.
right.
It works for me. It may not work for you. So I can learn things within an hour by doing that. But man,
Wow. In
but
an hour?
yeah, but big exams like. Cause man, like, okay, listen, I'm not hating on anybody that uses highlighters and marks everything on their paper.
Right.
But if you want to learn something, you have to be actively involved in it. That could include teaching
That's
others,
what I
teaching
did.
to yourself. Um,
And that's what I taught others, and I would write little like notes while I'm
yeah,
studying, but mainly I taught others.
and the other thing is understanding the material. Now, can you understand anatomy? Maybe not completely because you got to know stuff, right? You can't just. But I like to kind of like pick up a paper,
Yeah.
let's say a slide. If I have to memorize, this is only if I have to memorize it. Pick up a slide, look at it, put it away, and recall anything I can recall right away.
Right.
And
Dang, man.
and that's what I
Yeah,
really
see,
love.
I had my memory was not great, so I had to read stuff a bunch of times. Like I feel like I had a memory of like, I don't know, like a chimpanzee or something.
Bro, chimps have good memories, man. Come
What?
on.
All right, fine, fine. What about a goldfish? Memory of a goldfish.
I don't know, man. Yeah, goldfish don't have good. What are those? What are those fish that eat their like kids and daughters or whatever? Not kids and daughters. The fish that eat their like.
Each other, like the beta
Yeah, yeah,
fish?
yeah. Is that beta fish?
I think so.
I don't know,
Like
man.
the really colorful
They're
ones,
tiny. Yeah, they're colorful and they're tiny. Like
beta
guppies.
fish.
Guppies.
I don't know.
I gotta look
But
this up.
yeah, man, my memory was not great. So I did a lot of studying.
Oh, they're called
And
guppies, man. They're called guppies. I think they eat each other. A lot of fish do. Anyways.
all fish all fish eat fish.
Yeah. Oh, actually, yeah. You're right. You're right. But yeah, I know school was like academically speaking, anatomy I struggled with because
I loved
I didn't enjoy
anatomy.
it. I thought it was dry. Anything else? I loved it.
What was your
Neuro
what was
favorite
your favorite
subject?
class? Yeah, favorite class subject.
Neuro.
Neuro.
Where's what was his name?
Dr. Carnes.
Dr. Carnes and his color comments. Do you remember every time we have a lecture, he walks up to the board, he goes, I don't know what color is orange, cyan, purple, like bro,
Yeah,
like those are all three different colors.
I know. And then he'd pronounce muscles and things differently. Like he'd say masseter, and then he'd get upset when I said
Is it
masseter.
masseter? It's masseter, right?
I would say masseter. He
Okay, I
got
want to
mad
ask you
when some
something. Is it
masseter.
capillaries or capillaries?
Capillaries. English in like England, they say capillaries.
Oh, I say
Cap-
capillaries. I was getting made fun
Capillary
of.
sounds so much awesome,
I was
but so
getting
much
made fun of.
better. But I say capillaries because I'm
Oh, okay.
boring.
Okay.
And
Um,
he'd say malleolus, and I'd say malleolus, and but he'd get mad at me. He'd get upset. And when I was TAing people, and he would get upset for me for saying malleolus and not malleolus.
but yeah,
He was a
neuro
funny
for
guy.
sure. It was fun. It was
Neuro.
tough. It was fun. Um, really loved that course. It was I think it's because it was challenging, and doing well in a challenging course always makes me feel good. I
Yeah.
personally like the challenge. Least favorite course, Nico. What you got? But what's your
Oh man,
favorite? What's your favorite?
my favorite. Oh man,
You
that's
can't say ortho because we both love
no,
ortho.
no. It definitely be anatomy, 100%.
Anatomy.
Just something about cutting open those cadavers. I'm telling you, man, like I don't know what it was, but like I just loved it. I loved teaching it. I loved everything about it. I loved like just helping kids learn it, everything. I loved anatomy.
So anatomy was probably my least favorite, but guess what, man? I'm still doing continuing education courses because you can never
Uh-huh.
stop learning. We talked about this.
Yeah.
And as I do that, I go through the anatomy. And
I
I
know
can tell.
you always need it.
But listen, man, I love anatomy more than anything right now. Like,
That's welcome to my life.
as far as like, okay, that's a little bit weird. That's just I just may sound like I have no life, but I mean, like, I like anatomy as it relates to what we're learning.
Physical therapy. That's
And,
right.
and
Like
yeah, go ahead.
oh, I have, I have something like I don't know, like my quadricep is weak, my rectus femoris. What innervates it? What level does that come out of? That's all anatomy. And that's why I love it, because you can use that and think back like, oh, okay, this is what I need to do.
No, but that's the thing though. See, when we were learning anatomy, I think that's what
Uh-huh.
schools can do a little bit better. I know it's a little bit hard to do. Is like you learn anatomy, right?
Uh-huh.
Dry and stuff. Rectus femoris you mentioned, right?
Right. Rectus femoris. What
Origin,
is
AIIS, right? Whatever. And then insertion, whatever. We're not gonna get
right?
fancy.
Innervated by
Innervated
what?
by femoral nerve, right? All that
Right.
good stuff, right?
L2, L4.
Sure.
Correct. And so
So, but it's
focus on L2.
but that's what you know. That's what you learn. It's the same thing as someone telling you to memorize a bunch of numbers on the screen. Who gives a crap, right?
Okay.
You just have a bunch of numbers on the screen because you don't know how it
I
relates
see.
to it.
Because you don't know how to, yeah, you
No.
don't know. I see what you're saying.
But all of a sudden you talk about quadriceps strains, right? Grade 1, 2, 3, and then you're talking about maybe pain at different areas of, or maybe talk about like a nerve issue, and now you're
Right.
like, oh wait, quadricep muscles, they're in this
Yeah.
area. This is what the patient has difficulty with. Maybe they can't control their squat, as they squat, and it just kind of starts to make sense.
Uh-huh.
But when you're learning anatomy and you're like,
It is pretty
like,
dry,
oh,
right?
L2, L4 nerve innervation. Wow, whoop-de-doo. Who gives a
Yeah.
crap?
Like, what does that mean for me? What does that
Yeah.
mean? But then once you start doing the clinical stuff,
Am I allowed to
then
say
it's like
crap? Is that censor worthy?
that's fine. But yeah, like once you start putting in the clinical stuff, then it's like, oh wow, like I really need my anatomy. I really need to know these things.
Sure. And I honestly, my other beef is the same thing with like palpation.
Mm-hmm.
Like in functional anatomy, again, I don't know how else schools can teach this, but you start palpating things, right? Well, I'm just going to
Okay.
talk by the knee because that's all I've been learning about lately, as I do my continuing education courses. But let's say you're trying to palpate like the LCL or the MCL and stuff like that, right?
Okay.
And as I learned these things in more detail, I'm like, oh, okay, from here to here to here. And I'm like, okay, this all makes sense.
Yeah, you
But
know kind of where to look because you
exactly
know
where
where
to
they
put your
attach.
hands to. But
Yeah.
but when you're learning it, you're like, oh yeah, it's on the outside of a knee or the inside of the knee. You go to the functional anatomy quiz and you're like, oh, it's right here, right? I mean, but we can be so much more specific once we
Exactly.
you just can have a better understanding once you know what you're doing.
And that's what I like, just being as specific as possible. Because it's one thing to say, they have weakness of knee extension. That's one thing. Sure. Will the notes be okay if you say that? Sure. But if you take a deeper dive into it, you can realize like, well, they have this facet issue at L3, and that can play into a role into why they're having weakness in the quads.
Yeah,
So things like
yeah.
that, just little things like
and again,
that.
you just said facet. Man, for the longest time, first year, zygoapophyseal joint, is that what it's called? That's a facet joint, right?
Zygoapophyseal. Yep.
Oh my goodness. So I was like, what the heck are those, right? In fact, I took a -1 on that one on the functional quiz. I still remember. He goes, you'll point at it, right? I go, it's 1 inch from or 1 thumb away from the spine. Like I was like, I don't know.
Right. And that's when it gets more fun, I think.
Yeah.
Once you start putting the classes together and clinically it starts making more sense.
Yeah, I agree. I think that's when it really starts to make sense. But anyways, long story
That's why I
short,
love-
anatomy
that's
was
why I
my
love
least
anatomy.
favorite course.
And that was my most favorite.
But it is no longer the case. Other than that, school experiences, I'd recommend find someone that you click with,
Uh-huh.
or some buddies. Is that English?
Right.
But that you click with, and ultimately you can kind of study together. I'm an individual studier, but I love studying groups. I think it makes it more fun.
Mm-hmm.
It sounds really cringy, but on not exam days, but I love getting up in the morning and studying with people. It felt good.
Yeah.
I don't know.
Yeah.
It's fun.
I was kind of the same. So we never really studied together a lot. Maybe like the third year at the very end,
even then,
a little bit.
Even then, I was kind of preparing on my own. Yeah.
So but the way I worked and the way I studied for the 3 years was I would study the material by myself and learn it, and then I would go on and like study in a group And then what was good with the group is because they would ask you questions in ways that you wouldn't even think. And so that's why I like doing that. And we would just help each other. And I would ask them questions, they would ask me questions. And so that's why I loved that studying with a group aspect. But I know, like, if I didn't study by myself at first, I wouldn't have known anything.
Well, that's the thing, right? I think that you make a great point. I think if you're going to do group study, your efficiency is a little bit lower, right? I mean, there's a lot more room to goof around and not be focused on topic. I think group studying works if
Uh-huh.
both or multiple parties kind of have a general understanding of what is going on.
Right.
um, or you're both starting fresh and you're focused on it. Like you both don't know anything and you're just focused on those slides together.
Yeah.
And then you quiz each other after 5 or so slides. Like I did that with Eric
Yeah.
when we were
And
studying. But
I definitely, I definitely had times where I didn't study ahead of time, and I would study with my group and they just be asking questions like, and I'm here like, wait, what are you guys talking about? And I would have no idea. And then I would feel flustered, and then I would feel intimidated. And so that's why,
that's
why
true, man.
I learned.
Honestly, that's the thing,
Yeah.
right? As soon as you don't know, like I said 160 slides, right? Let's just say 100 slides, right? And you don't know anything on the 100 slides, and somebody walks in and you go, blah, 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 blah,
It's
blah. And you're like,
intimidating.
wait a second.
It's intimidating,
What?
right? Absolutely.
But once you know the material, you're like, cake.
Yeah.
I mean,
So,
there's look,
go in
man.
your own pace. Don't compare yourself to other people, but
Yeah, don't compare yourself to other people as far as like even grades, man. Honestly,
mhm.
they're just a bunch of numbers. Don't.
Grades don't matter.
Okay,
Once
they
you're in,
matter because you have to get an 83 plus to actually pass your courses. Anything
oh yeah,
beyond.
so in America, there's a saying, C's get degrees, and a C typically is a 7D, I think, but not in our school. No, a C was not enough. You needed to get an 83. So
Yeah, so that was a cutoff.
so not a 70, it was an
And then there's a
83.
strikeout, right? If you get two 83s or less than 83s, you get third one, you're out. Is that what it was?
I have no idea, man. I didn't mess
I
around with the
forget.
strikes.
Not me
But
neither.
I mean, every school is different. I mean, there are PT schools out there, where 70 is the cutoff. And I think we also had a chiropractic program that was also in our school. And I believe their program, they used 70 as their number.
Anyways,
So
long story short, just meet the
yeah,
cutoffs and I'm
meet the
not saying
cutoff.
do your
That's
bare
all you got to
minimum.
do.
Honestly, I like challenging myself, so I personally enjoy getting as high as I can.
Yeah, I was a nerd, man. I dedefinitely
Unless it's the final,
strove to get those A's.
unless it's the final exam, and I look at it, I go, I can get by with a 55. But
I still remember when I was like freaking out about an exam, and you were like, "Nico, why are you stressed? You
good old
need like a
cardiopulmonary.
yeah."
The
And
cafeteria. You're sitting there in your little laptop. You're like looking at the material.
I was stressing.
Walk up to you, and I'm casually walking up to you, not even worrying about anything. Okay, I still studied, right? Come on, I still studied.
Right.
But I'm just saying, I wasn't like bulging my eyes out, like
I
I'm gonna
did.
fail it. But
I
I'm like, bro, you need a 55.
even less, dude. You told me like a
No, it
low,
was a
like
40 something. It was
yeah.
really
You
low.
told me, and I was like,
And I was like,
dang,
man, if you can't get that grade, you might as well just walk out of the program, right?
and I was like, dang. Like once you put that in perspective, I was like, man, like why am I stressed?
And that's the thing, right? Don't listen, man. Like in the heat of the moment of studying for material, you're gonna retain what, 20%, 10%? I think it's 10%. It's very low
Mm-hmm.
once you're done school. Once you start working and actually, now that you started working and now that you're seeing cases,
Mm-hmm.
all of a sudden you start specializing in one area, you retain
Mm-hmm.
way more. You retain
Yeah.
way more with practice than you do just by memorizing a bunch of things.
That's right. Like
Um,
getting an A in school,
it's
having
good.
a
It's good,
it,
but
but it won't. It doesn't mean that
I don't think it translates to a better therapist.
yeah, exactly. I agree 100% with that.
I don't think it translates to a better therapist. I'm sure there, eh, what you do after with it is actually more of an indicator,
Yeah.
right? No,
Yeah.
it's not your grades. Your grades don't equal performance. I don't think it
Yeah.
does.
I
But
agree. But saying that, I was raised up Asian, so
but it does help.
I
Like,
did
listen,
try.
we say grades don't matter, but we're gonna get into clinicals in a bit. But man, so knowing your stuff in clinicals helps, because when
Helps.
somebody's talking to you and trying to teach you and stuff like that, and you know your stuff, it makes sense. So you have to have
Mhm.
some base knowledge. Just don't stress if you miss like the splenius capitis or something like that.
Yeah, it's not
you know.
not a big deal. So clinicals. So what are clinicals, Payman? What is that?
So clinicals are basically, what is it, volunteering? No, I'm kidding.
No, it's not volunteering.
I'm kidding. I'm kidding. Clinicals are basically you go to different settings and you're under the supervision of another physiotherapist or physical therapist, and you basically treat.
And
You,
that's when we can start seeing patients.
I would say you're basically working.
Yeah.
Now, having said that, you're not really jumping into maybe treating patients right away, but depending on where you're at and what year you're at, you're kind of slowly building up to it.
So the way our program worked is we had 4 clinicals. Um, and the first one was kind of introduction, getting our feet wet. And then by the 4th one, they basically expect you to do everything a physical therapist should be able to do. And you should be seeing and treating patients by yourself.
And that makes sense because
Yeah.
after that, it's you and the world.
yeah.
And there's no supervision anymore.
Exactly.
So it's really important to be able to do that.
How are clinicals for you? Do you have any stories for clinicals, or
Do I
any
just
fun
go
stories?
clinical 1? It was amazing. Clinical 2.
No. I mean,
sucked.
like,
No, I'm kidding.
I mean, any like things that stood out?
Okay, I have a lot of stories. Because clinical 1, right? First of all, clinical 1, I was nervous. I was
Here's
smart
your
in
first
school.
one.
Yeah, exactly. And I was smart in school, but at the end of the day, you don't know what to expect. You got this authority figure, and you want to make sure you do well.
Right.
Everybody knows, even now, when there's an exam, you're probably still gonna get nervous. It's just the reality of it.
Absolutely.
reality.
Absolutely. No matter how much you prepare for it.
No matter how much you prepare for it, because you want to do well and you care, right? So it's a good thing. So first clinical, man, I remember. Do you remember those tools? Those ISTM tools?
Sure.
The one that's like, it's curved like this and it's straight. The blade edge.
I don't
Blade
know that
something.
specific one. I don't know that specific one.
Oh, what's
But
it
anyway,
called?
it's an ISNMS tool.
And my
Anyway.
PTA Jill was doing this on the ankle, right? On an Achilles tendinopathy or some sort.
Okay.
And then they're like, "Yo, Payment, do you want to do this?" I was like, "No, I like I don't like that." And then
What do you mean you don't like that?
and then my CI pulled me to the side and he goes, "Do not say that to the client. What is wrong with you?"
Yeah, baby.
And listen, man, and that's not what I meant. It's just at the heat of the time, sometimes you say things that don't make sense. Hashtag real life. But I was like, but anyways, he didn't have time to listen to me. So then later I explained to the other therapist, I was like, I didn't really mean I don't like that. I love ISTM. I do it to this day. I had the Hawk Grips tools.
Right.
What I meant to say to was that tool just didn't conform to my hands. Like I just couldn't use it effectively.
So that first clinical, you learned a valuable lesson into choosing your words wisely.
Hashtag communication is important.
Communication is important, especially when there's a patient in the room.
And then there was another, another first one. I was taking the blood pressure of someone and it read like 175 over like 55.
What?
It was something bizarre. And I was like, my eyes started kind of like keep tearing up. I was like, I don't know what to do. So I walk up to my CI. I'm like, or maybe it was 140. I think it was 140. But I was like, why is his resting blood pressure 140? And he's not taking meds. But I was freaking out over something. And he's like, it's okay. Don't worry about it. Like, before all these new cutoffs were made, it was a little bit more,
right.
And stuff.
Right.
Like so my CI was really good in like calming me down. Yeah, first clinical one was fun. I lowered the high and low. It was a giant high and low table. I think I lowered it on his feet as it was. I don't know. I've done some very interesting stuff. But
so you can do a lot of stuff, guys, and still not fail clinicals. It's okay.
Come on, man.
Right? It's okay.
I didn't do it to the patients. It was my CI that took the beat.
Yeah. So I completely understand people that are nervous going into clinicals and, oh, I'm gonna fail, or what if my CI doesn't like me? What if whatever?
And that is a possibility. A CI may not like you, but
it's okay. You do not need to be perfect, right? You can make mistakes. That's why you're there for. That's what clinicals are
if
for.
you're perfect, would you really need clinicals? Absolutely
exactly.
not.
So it's okay to make mistakes.
Yeah. So those are basically my 2 stories from clinical 1. Clinical 2 was probably one of my best. I think clinical 2 changed me as a therapist.
Oh. Okay.
Clinical 1, I was like this shy person. I was
Sure.
good. I was smart. I knew my material.
Sure.
but I didn't have. I don't think I was able to apply it per se, and I wasn't very good at evals. I didn't do too many evals.
Okay.
But clinical two in Pittsburgh, my CI, top of the food chain, um, and at Concentra in Pittsburgh, and manual only clinic,
Whoa,
and
whoa, whoa, don't be saying like where you went.
it's all good, man. I love the place. I highly recommend for anyone that's applying to PT school, go to Concentra. um, but no, CI was so good. Taught me all these manual techniques and stuff like that.
Mm-hmm.
And
Mm-hmm.
and she was the one that said I would do something like I did. I forget what I did, some technique, and I was like, "Yo, it made the patient feel better." And she goes, "Why'd you do it?" And I go, "Well, because it made the patient feel better." She goes, "What was the indication for it? Did you do any tests before it?"
Mm-hmm.
I was like, "Shoot, I did it." So she kind of, helped me,
Mm-hmm.
how, why do you do the things you do?
Right. 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 Right.
Have a reason for it. So two was good. Three, I'm not going to name where I went for three. Awful. Didn't enjoy it. Um, it was not fun. It was not the setting for me. I didn't have a good time. And I just want to tell everybody that it's okay that, you may not enjoy all your clinicals.
Yeah, you might not enjoy them all.
But please stay professional.
Mm-hmm.
Make sure you ultimately put the patient ahead of your needs and stuff like that. Even if the clinic sucks, even if the clinical sucks, even if your CI sucks, patients matter. And you should always treat them to the best of your ability.
That's right.
So stay professional. Fourth clinical,
Mm-hmm.
again, loved it. I think fourth, the volume was really high. I was seeing like, for an hour at one point. It was
Mm-hmm.
but again, got me used to the fast-paced environment. So all
Right.
of a sudden I'm seeing to an hour, I'm like walking, I'm like, I could watch TV and do this. No, I'm kidding. I
Right.
can't do that. Don't do that. But clinicals were good. My
Yeah.
clinicals prepared me well for my work environment.
And I think the most important part is with each clinical, there should always be a lesson you learn. So for me, for example, my first one, that was just me getting my toes wet. That was me
By the
realizing,
way, this is
oh,
the first time I'm actually learning about your clinical experience.
oh.
I have never talked to you about it.
So yeah, so my first one, acute setting in a hospital in Buffalo, and it taught me like, oh, I know what I'm doing. Like, I'm prepared. I'm ready for this. Like, I can do this. Like, trust myself. The second one, I learned how to be like, just like you said. So that was a outpatient in Florida. I learned to be fast paced. I had a bunch of patients come in at me at the same time, and I learned how to multitask and kind of what I needed to do, just to be successful. Third one, I learned the importance. That was third one was an outpatient in New Jersey. I learned that physical therapy at the end of the day is, um, you need to make the customer happy. And so I kind of learned how to do that,
Okay,
right?
make the customer happy. Maybe kind of elaborate on that because
So
you're
like,
clients are customers. So maybe kind
sure.
of
It's like,
like, what do you
so
mean by that? Because when you say
like
customer, I think of like grocery
customer
stores.
service. Yes. At the end of the day, physical therapy is all about customer service. You have to do the little things to make them happy. Just little. I mean, like, what's an example? Just like the smiling, and
What's the
I don't
example?
know.
I'll give you an example.
I don't
You
know.
walk
Yeah.
in and somebody has a cold face and they get to treating you and you walk out. Pretty much the worst experience of your life. I don't care how good of a
Yeah.
treatment you got, right?
Yeah. Yeah. It doesn't matter how good of a therapist you are. If you are not doing a good job with customer service, people aren't going to go to you. And so on the third one, that's where I learned, like, oh, like, this is just customer service. Like, we're just trying to make these people happy. And yes, we're also making them better. But if you don't make them happy, they're not going to come back. So that's kind of what I learned on the
Which
third
leads to
one.
compliance. We'll talk about that later.
Right. Right. And was the stuff that the guy was doing and what he wanted me to do, was it like things that I would do? Not everything. I didn't agree with everything he did. Um, but I still did it, right? Because
Okay, so
it's his license.
that's a good point. A lot of times, depending on which setting you go to, you may or may not agree with the instructor or
Mm-hmm.
the supervisor, right? The
Right.
supervising PT. Um, What do you think? Should we kind of maybe could we have a chat with them sometimes about it or
Yeah, I mean, as long as you don't go about it with like attackingly, if you go about it in a way where like, oh, like why are you doing this? Can you explain to me your train of thought? And and just like how we talked about in a previous episode, there's a lot of ways to treat a patient. You know, it's not just your way. So if you keep an open mind and understand like, oh, like I can do this or this or this or whatever, that patient can
but
get better.
having said that, I do want to say that if you do see, people make mistakes and mistakes
Yeah.
happen. So
Mm-hmm.
if you're in a setting and you see, maybe like don't put a shut eye to it and assume they know everything either. Like I'm just gonna give a quick example. It may or may not be what I experienced, but um, so if you see heat and lidocaine used together, and as we know, they're not supposed to be, um, like don't put a shut eye on things because ultimately you're also treating them. You're
Mm-hmm.
also signing, and they're co-signing on you, right?
Mm-hmm.
So what you do matters.
Right.
So if you see something is wrong, don't
Say
assume just
something.
because your
Yeah.
CI was like okay with it that
Yeah.
everything
That's
is
true.
okay. Because
Yeah.
guess
Say
what?
something.
If you messed up, you messed up.
Yeah.
As a physiotherapy student, you're still held accountable.
Absolutely.
So don't just shut your eye to everything. But having said that, don't also nitpick every little detail either.
Yeah. Yeah.
Like if they
It's
had the
about
patient
find a
position,
balance, you know?
if they have the patient position 45 degrees for a technique and it's supposed to be 50 degrees, like don't like
Yeah, it's
attack
not
them
a big
immediately.
deal. Yeah. And you know, he was an old school therapist but yeah, I really learned the importance of customer service from him and
Yeah,
that
that matters.
super valuable. Super super
So that's
valuable.
your
And
second one, right? And you
no,
got
that was my third
that was
one.
the third one. Yeah, okay.
Yeah, yeah,
Second was Florida.
yeah. And my last one was an outpatient in Texas, and that was by far my favorite one. I learned from a
Okay, maybe
fellow.
say what a fellow is if
Yeah, so
anybody doesn't know what a fellow
a
is.
fellow is like so FAOMPT, Fellowship of American
Fellow is the Men
Orthopedic,
in
whatever.
Black of physiotherapy, right?
So these guys, so the fellows, they are the highest level of physical therapy. They do after they graduate, get their doctorate, they continue with school for another like 3 years. They do more learning, and so yeah. Anyway, they're the highest level, and there's fellows in all different settings. You know, orthopedics or cardiac, whatever. So he was a fellow, and he taught me a lot. But really, I learned to be specific. Like I was kind of saying earlier today, it's not just enough to say he's got weakness in the quads. That's not enough. Why does he have weakness? You know, because you have to be as specific as possible, and I loved that.
Dude,
And
that's fellows, man. Oh my goodness. You know the guy
yeah,
that came in to talk to us about the license exam?
uh-huh.
Wasn't he a fellow? The guy in the suit?
Yes, yes,
He
yes, yes.
was, right?
Yeah,
Man, I was like, that is so freaking cool.
yeah,
Guy comes in his suit. He goes, joints inflamed. Why are you putting heat on it?
yeah.
And I'm
Seriously,
like,
and
oh, I love
the
that.
way
I love, I
they
love
make
that.
you
Yeah.
think differently. Oh my gosh, I learned so much from this
I
guy.
love it. They're like, oh, joints inflamed. Why are you stretching it? Just do PRO.
Yeah,
Stuff like that. Little things,
yeah.
man.
Little
And
things. It's all about
and
little
and I
things.
was like, whoa, that's so cool. So guess what? After school, you can still do more school.
Hmm.
Am I doing fellow? I'm not, but
Yeah,
that's just
yeah. So yeah, so that's our clinicals. Then after that, we had to take the boards, which was for me super stressful because
why was it
I took
stressful, Nico? Was it because you took the boards early
yeah
and
because
you also had to do a cat project?
I took the boards in April, like April 20th or something. It was a Wednesday. I remember it. Like anyway, and the reason why it was so stressful is because I took it, and then later that day I had to present the research that we worked on for like what 2 years,
No, man.
a year and a half.
Well, we did like a mini one and then we did the
Yeah,
full one.
yeah.
But you didn't
So
do it
that's what.
alone. You still did it with somebody. So it wasn't
Yeah,
like,
but that's why it was so stressful, Payman. Like I had to
well, why
literally
did you take
right
them
after
together?
because we were already studying like so to in our school to graduate we had to take a test which was basically
Competency exam.
yeah competency exam which is like a practice board exam to pass, and I was like, well, since we're already taking this competency exam and I'm already studying for it, like I might as well just take the boards early. So I took my boards, and literally guys, after I took the boards, I sat in my car for 15, 20 minutes and I was just like, what was that? Like, that was just so hard. Like, that was the hardest thing in my life. And I was just like, I just completely failed that 15, 20 minutes. And then I was like, I can't sit here and be sad because now I got to go drive an hour and now I got to go present my research that I've been working on for so long.
Yeah, I remember that. You were right beside me, I think, or behind
So
me.
stressful.
Rather, yeah.
But we did it, and we passed, and here we are.
Yeah, so if you're one of the lucky guys like Nico who did it early and they get to rub it in your face as you're sitting in the cafeteria. I still remember, man. I got up to the cafeteria. Who was it? So I think it was a bingo night.
Oh, that's when I found out my
Go to the
results.
cafeteria, right?
That's when I found
And
out my
who was it?
results.
Was it Lisa Madera that passed it?
I don't know.
Somebody passed. Oh, it was Lisa. It was the other Lisa Gardner.
Okay.
Turns to you and goes, Nico, I love it. We passed. And here I am sitting there going, F, man. I still haven't taken it yet. And man,
You had to wait like 2 months after you graduated.
and
or
that's
something.
the one thing, right? Honestly, I was like, man, I don't get jealous for a lot of things, but I'm just like, man, this sucks.
I remember that bingo night, man. Oh man, that's when I found out.
That's
I
when they
passed.
found out that they passed.
It was
And
it's a great
so
feeling, guys.
a lot of us passed the first time. A couple of us failed, I think.
A couple of us failed,
in
and it's all
April.
right.
And then you just get to take it back in June. So honestly, even if you took it early, you could have taken it back in June, right?
Yeah. So it's all right, guys. If you fail, I knew people that fail, and they're fantastic clinicians now. So if you fail the first time, it's okay. You might not be a good test taker, and that's all perfectly all right. I thought I
Yeah,
failed.
honestly, go at what works for you. Like I didn't take it
Yeah.
early. Like for me,
Yeah.
like I had to take the Canadian exam, right? So I was
Yeah.
like, okay, so if I take it now, and I'm gonna take this Canadian exam in September, now we got what, April, May, June, July, August for the next 5 months. I'm not gonna retain all that. So what I did was I took it in June. So all I had to do was kind of refresh myself in August for September. So I kept
There
them
you
close.
go.
So I kept them closer together so I can pass
Yeah.
both exams, right?
Yeah. So you had the memory, that stuff in your memory.
Exactly. So I did it a little bit differently, but
So guys, yeah, I mean that's our experience. We hope that it was helpful to you guys, especially those that are thinking about going to PT school or they're currently in PT school and they're thinking like, is it worth it? Like, yes, So hopefully we helped.
But I do just want to say that, like, if you guys have specific questions, like if there are any students that have specific questions that we didn't cover, that maybe you're nervous about or you want more guidance, hit us up.
Yeah, I mean we can talk about it in the podcast or we can
Or
talk in
we'll
private.
directly talk to you guys.
Yeah.
We'll get into a Discord call, Skype call, WhatsApp call, you name it. And
Yeah.
I'm always down to address it and help you guys out.
Yeah, like I said, we love talking, guys, and we love teaching. So definitely hit us up. Yeah, so thanks for tuning in. For those of you guys that are listening to the podcast, make sure you give us a review on Spotify.
Positive or negative, preferably positive, but we'll take the negatives as well.
Spotify, Apple Music.
And
or
yes,
Apple,
my camera
Apple,
is not facing me. I know.
Apple Podcast. We finally got Apple Podcasts working.
Nice, man. Awesome.
Yeah. And or wherever you listen to your podcast, hit the like on YouTube, likes our stuff on Instagram. We are PT Chit Chat on all platforms.
PT Chit Chat, PT Chitter Chatter. That's how we do it.
Okay. We're not doing Chitter Chatter. Payment thought that was going to be a good name for us, and I said
I had a
no.
bunch of good names, man. But anyways, we won't talk.
Anyway, guys, you guys have a great rest of the year. Oh, Happy New Year, by the way.
Oh, it is New Year's.
Yeah,
man, why
Happy
didn't we
New
start
Year.
off with that?
I don't know, but Happy New Year's, everybody.
It's January 3rd, 2021. Let's go.
Also, next week we will have a special guest. We're not going to tell you guys who. Look forward to it. We are going to talk about pain.
Pain science, pain management, anything pain related, right?
All right, guys. You take care.
See you guys.
Bye.